The city of Toronto saw its highest levels of tuberculosis in more than 20 years last year. And public health officials are saying the rise underscores the challenges of fighting the disease, one that has plagued humanity for centuries. CTV's Vennavally-Rao has more on the recent spike.
My name is Pasha Killen and I live in Gangswalja.
In this video, a woman from Nunavik describes her experience having tuberculosis.
When I had TB, I didn't feel any stigma or anything.
TB has long been a problem in Inuit communities, where a lack of healthcare access and overcrowding in some places have thrown progress in reverse.
Not only are we not progressing towards reducing the cases, but we're doing worse than we were previously.
And a new report by a group called Stop TB Canada, drawing attention to a disease Ottawa pledged to eradicate. Only doctors say much more needs to be done if they want to reach that goal.
If anything, the rates have been trickling up over the last decade.
In fact, in Toronto last year, 375 people were diagnosed with TB, up from the year before and the highest in 2 decades. Usually affecting the lungs, those who get sick are often migrants from a part of the world where TB is more common, an infection that can lay dormant for years.
So they came with that sort of silent sleeping TB. You would never know unless you get tested.
Just this week, Kansas City sounded the alarm after a TB outbreak killed 2 and infected 67 others. Symptoms can include a cough that lasts more than 3 weeks, coughing up blood, fatigue, and weight loss. There are antibiotics, but the report found several drugs that can address more challenging cases aren't easily available in Canada, especially those that are child-friendly.
Right now, we're relegated to something that looks like 18th century alchemy, where you have to grind pills down, hide them in all kinds of foods so that the children take them.
They say pharmaceutical companies don't market some drugs here because the number of cases is still relatively low, and they say there's not enough money to be made here. But doctors want to see better access, calling for the approval process to be sped up and simplified. Vennavally-Rao, CTV News, Toronto.